second here. All right. Well, welcome everyone to the, I don't know what's going on there. Sorry. We have a new MS Teams and this thing just started. Welcome everyone to the Region 6 Planning and Policy Council meeting for October. My name is Kirby Fye. I'm with the department. Just a few things I'd like to go over before we get started. For those of you who have been to all these meetings, this is nothing new. But for those of you, if this is your first time, we will be recording this meeting because we're holding it virtually, and usually we hold it in person. We're holding it virtually because we decided as a council that this was just the best option to keep everyone safe right now. We'll cross that bridge, I guess, the next quarter in January on how we'll meet then. But for now, we're meeting virtually, and it will be recorded and will be posted to the department website within the next day or two. So with that being said, please keep your computers or your phones muted unless you're presenting. It just helps with any feedback. And also, please state your name when you're presenting or asking any questions. It's helpful when capturing the minutes. I'm going to go ahead now and do the attendance. Like I said, my name is Kirby Fye with the department. We have Avis Easley, who's also with the department. Dina Zip, Jerry Moore, Julian Stone, Cooper Arkell Bryant, Leah Gray, Lori Hendon, Lynn Julian, Marcus Jones, Megan Houston, Richard Barber, Tammy Bass, and Megan Gaylord. Did I miss anyone? Okay. All right. I'm going to hand it over to you, Richard.
Okay. Thank you, Kirby. Welcome, everyone. As always, thank you for taking time out of your day to participate in the Region 6 Planning and Policy Council. If you're new to the council, you know, what I think, as far as I look at it, one of our biggest responsibilities is to identify the needs in Region 6, make sure we communicate those needs and back it up with data and get it to the department where we can keep Region 6 serving the people that we're charged with serving. So thank you. The work we do is important, and we appreciate you taking time out of your day to do this. And like Kubra said, I can't wait till we all get back together. You know, we're all friends, and we've all worked together for a long time. And you know, I'll miss y'all. I'll just say that, and I'll be glad when we can all get back together. So, with that, we'll get started. Kirby called the roll, so we'll do. We'll skip the introductions, and then at the end of the meeting today, we'll have an opportunity for each person to make agency announcements, anything that's going on with their agency, and we want to make sure we can get that out there. So I think the minutes, the July minutes, were distributed early. If you've had a chance to look over them, the chair would entertain a motion to accept the minutes. I said the chair would entertain a motion to accept the minutes.
I move that the minutes be accepted.
Thank you.
I second that motion. Megan Gaylord seconds the motion.
And who made that motion?
Lynn Julian.
Was that Lynn? Okay.
It was.
Okay, the motion's been made and properly seconded. Is there any discussion? Seeing none, we'll call for a vote. All for accepting minutes, please say aye.
Aye.
Raise your hand.
Aye.
Any opposed? Motion to accept the minutes carries. Kirby, I think you have the department report.
I do.
Somebody's eating some chips.
I do. I have it. And Lori, I will, since you're taking the minutes, I will send you this and you can just copy and paste it and put it in your minutes because it's a lot to write down. Yeah.
Thanks.
You're welcome.
Oh, what? Can I interrupt you, Kirby?
No, go
Can
ahead.
I interrupt you just a second?
Yeah.
Because I skipped something. I wanted to make sure we got this in. We want to say thank you to Lori Hendon of Career Counseling for accepting the role as secretary.
Yes.
Our secretary had to move into some other responsibilities and had to give her position up. So Lori, we really appreciate you taking on this role and just want to say thank you.
You're more than welcome. It's my pleasure.
Okay, Kirby, sorry about that.
No, not at all. Okay. So just a few updates since we last met. The first update, year 3 of the FY 2022 3-year plan is complete, and it can be found on the department website. And I've included the link in this update for where it can be found. The August report of the year 2 FY 21 3-year plan is also complete. That was shared with your regional chair and vice chair. So if you would like to take a look at that, please reach out to Richard or Lynn and they'll get that to you, or me. I have it too. The FY 22 mental health block grant application was submitted to SAMHSA on August 26th. The FY 22 mental health block grant report is in progress, and the councils will have an opportunity to review that document soon. The department is expanding On Track Tennessee, Tennessee's first episode psychosis initiative, to 3 new counties. Funding for this expansion is coming from, federal COVID-19 pandemic response grants. On Track Tennessee works with youth and young adults ages 15 to 30 who have experienced a first episode of psychosis. This comprehensive intervention model uses a team of mental health professionals and support services, focusing on helping people work toward recovery and meeting their personal goals. The new locations for On Track Tennessee are Montgomery County, served by Mental Health Cooperative, Anderson County, served by Ridgeview Behavioral Health Services, and Rutherford County, served by Volunteer Behavioral Health Care Services. These counties were selected for expansion based on a review of department mobile crisis data, which demonstrated a significant number of face-to-face crisis assessments for ages 10 to 24 in those counties. The department is receiving federal funding to support the mental health needs of people who survived deadly flash flooding in August. More than $116,000 in funding through FEMA Crisis Counseling Program will support services for residents of Dixon, Hickman, Houston, and Humphreys counties. The 4 counties were covered under a major disaster declaration following a devastating flash flooding during severe storms on August 21st. Mental health services will be provided through Centerstone, which has existing relationships in the affected counties and has experience doing this work following natural disasters. Funding through the grant will provide staffing for mental health professionals from Centerstone to visit affected communities, assess needs, and deliver services. This initial funding is designed to provide services for up to 60 days. The department is also applying to FEMA for an additional grant, which would provide extended support to survivors for up to 9 months. And lastly, and this information was shared via email yesterday, but I wanted to go ahead and include it in this update as well. But Tennessee Housing Development Agency has released an announcement of funding for their 2022 winter round of the Tennessee Housing Trust Fund grant. The grant now offers up to $600,000 for permanent or transitional rental housing development. The application workshop webinar will be held via WebEx on Thursday, October 21st from 9 a.m. till 11 a.m. Central. The link to join is included in the announcement that was shared. Richard and Lynn each have a copy of this announcement that was shared via email. Registration isn't required, and if you would like more information or have any questions, please contact Tony Shaw at THDA, and her email is tshaw@thdA.org. And that's what I have.
Wow. That's a quick department report. Thank you.
Lots of stuff.
Relative to that THDA announcement, I'm about to put somebody on the spot, and I apologize beforehand doing it. Dina, are you there? Dina's it.
Yes, I am here.
Can I put you on the spot for just
Sure,
a
go
second?
ahead.
Can you, and we did see the THD announcement yesterday. I know some of us participated in the department's team. for housing. Can you kind of just give us a 30,000 foot view of the difference in those two programs?
Okay, so the THDA Housing Trust Fund grant is up to 600,000. It's like she said, for transitional or permanent housing. It's to buy, build, or renovate existing homes and it targets those. You get more points on the grant for those with extremely low to low income, veterans, transitioning youth, and ex-offenders. With this grant, I've seen it successful in many ways, from renovating existing group homes to providers purchasing duplexes or quadplexes or even apartment buildings to assist those in the area that are homeless or literally homeless or at risk for being homeless. And there's a match. There's a 50% match, which of course that can be in the services that you're going to provide those that qualify. It can be in the property assessment, the cost of anything that you have that you're as the provider are going to commit to the project. The other grant that was supposed to be released Friday, but we're kind of waiting, and it's going to be a quick turnaround, is the Creating Affordable Homes grant, and it's through the Department of Mental Health Substance Abuse Services. There is no maximum on this. It is highly competitive because there is no match. And it is to create homes. It can be to build, to buy, or to renovate, just as the THDA is. They, in the past, have given a lot of, points to the review committee for those that are keeping people out of institutions or more restrictive settings, moving them from group homes into more independent living or establishing a group home setting. But this year, in my meetings so far, they're open to anything that will help house safely, affordably, and safe. So, I'm hopeful that we'll have lots of providers for that grant. I hate to say that it's an easy application, but is a lot simpler to complete and to carry out than the THDA one. And I'm checking my email about every 30 minutes, waiting for that NOFA to come out. It should be due around the second week of November. So it's a tight line to get it in. Last year it was reimbursement only. That is a reimbursement. You spend the funds and then you're reimbursed for cost. This year the reason it's so late is they're working with the wording to where you can draw down monthly so that you don't have to be out of pocket that whole amount. There will be percentages that will be allowed for you as the project is being renovated, built, or purchased. So that's good news. Did I answer any of your questions, Richard?
You answered every one of them, and I appreciate it. For y'all that don't know, Dina is a housing resource coordinator. She actually works embedded at Cary Counseling, but her role is to help develop affordable housing in Region 6, just like Jason Postlewaite. I don't think Jason's on the call today, but he's embedded here at ASPL to help Region 6 develop affordable housing for recovering people. So they've been a great resource for us, and they can be a great resource for you too if you're looking to do housing at any level, whether it's recovery, mental health, whatever it might be. So Dina, thank you. And thank you for letting me put you on the spot too.
No problem. Anytime.
Okay. Committee reports. Is it Jerry or Megan? I never know which one. For Children's Committee.
It's a little bit of both of us. I
Okay.
unfortunately had to miss the last meeting. So we continue to meet regularly. Excuse me, of course I have to cough. Okay, so we continue to meet regularly. Our next meeting will be on October the 21st at 9 a.m. online. We've been talking about doing a children's field day and are starting to collect donations for that. When we were looking at timing and Halloween and Thanksgiving and weather, what we've decided to do is push those back for both our Northwest and our Southwest areas to right before spring break. So kids can get some fantabulous I just made up a word, fantastic outdoor toys that they can have with them for spring break to occupy them, to get them outside, hopefully, fingers crossed, enjoying some fine, good weather, not a late March snow. Because we'd run into some difficulties using one of our sites we had planned with the Milan Parks and Rec Department, that they wanted us to pay for insurance, and like a liability waiver that we didn't have funds for. So either we'll need to solicit funds from the community to cover that, in addition to donations for the gift bags we are giving out to children. So that's all delayed until the March. It would be about $138 for the insurance. The department had let us know that there was no money earmarked for use by any of the regional councils. So we'll have to find someone who's willing to donate that, or we'll need to find a secondary location. So we might end up doing it in Crockett County. And it gives us some more time to get donations. So we are moving forward with working on our children's online magazine and trying to get that off the ground. Jerry, is there anything you want to add?
And we're still working on a nature guide for families. So those are our 3 special projects that we've been working on.
And at this upcoming meeting, we're going to have some guest speakers. So please come join us to learn more about some really cool children's resources that are opening up in our area.
I think Richard's screen is frozen.
I think so too.
Okay, well, he usually reports on the adult committee. So I'll just go ahead and pop in for a minute. The statewide adult committee is meeting tomorrow via MS Teams. It's open to the public, so if anybody is interested in attending, please reach out to me, or there's even information on the department website as well for how to attend that or participate in attending that meeting. There's going to be some discussion about the 2022 needs assessment, and there's also going to be a presenter on motherhood. It's called Cherished Motherhood, I believe. I'm sorry, it just slipped my mind. But it's on motherhood and depression and some mental health disorders that are often overlooked in postpartum women. So it'll be really interesting. Let me see here. Looking to see if I have anything from Richard. Check my email. Technology. All right. Well, if you have the Lynn or Lori, if either of you have the agenda up, either one of you can continue the meeting until Richard's able to get back online. I see him talking. Go ahead, Lynn.
Yeah. He just texted me. His computer is freezing up. I don't have the agenda up, but it looks like Lori might. But I can tell you, as the chair of the Region 6 Legislative Committee and the sole member, I wish someone would join me in this endeavor. I meet with myself often and ask myself what we need to do. So if y'all would come to me with some ideas about things we want to present next year, I'd be happy to hear it. And that's all I have for the legislative.
Is there anybody on the call that is not familiar with the legislative proposal process that is interested? I think a lot of people.
I'm
Go
not.
ahead.
I am not familiar with it, but That is something that we are doing specifically with Scarlet Rope, with the laws about trafficking and the prosecution and all that. And I actually have a volunteer who has a lot of this in her background with, I believe it's Mothers Against Drunk Driving. And so she, I would love, yeah, I would love to kind of connect her with you, Lynn, and myself as well.
Oh, that'd be wonderful.
Okay.
Great. Yeah, and the legislative proposals, I mean, it should be a year-round thing, so that's why Lynn's meeting with herself all the time. But because it could be quite the endeavor to take on if you wait until the announcement comes out on when they're due. But they're typically due, the last 2 years they've been due May 1st. Typically they're due June 1st, but I would just keep it all in your mind that it's May 1st because it has been that way the past 2 years. And usually an announcement goes out in March on the paperwork that needs to be completed. And Zach Blair, who's our legislative person with the department, he's going to be the one leading it this year. So he'll be able to answer any questions you have that I could not answer. So yeah, that's great. Well, look, you have 2 connections, Lynn.
And Julianne, maybe let's get through the holiday, November and December, but in January, let's definitely sit down and see what we are going to come up with, and let's turn in a proposal or 2. That'd be fabulous.
Okay. Sounds good.
Awesome. Thank you.
Mm-hmm.
Lori, you have the agenda up?
I do. Up next is the needs assessment preview. So, do we have that?
Avis, are you on the line?
Yes, I am.
Hey, should we go ahead and discuss the changes?
Yes, I think that'll be a good idea to do, and particularly since there's Richard back, I don't know, but yes, let's go ahead and bring that up.
Okay. All right. So, as you may or may not know, in the past with the needs assessment process, we always had 4. So we had 2 mental health, 2 substance abuse needs. It didn't matter if it was children or adults. It was whatever was identified. This might be Richard. Hold on one second. I'd like to have him on the line to hear this. Richard, is that you?
Yeah, let me mute.
Okay. There's some feedback there.
Yeah.
Richard, can you mute your phone? Okay, great. Yeah, there was some feedback. So we're just talking about some updates that are happening with the needs assessment starting this year. So it was actually brought to our attention from Region 2. Okay. Hold on, let me see. I see one more. Sorry, guys. Okay. So it was actually brought up in Region 2 where they had made this one of their legislative proposals last year where they wanted to increase the number of needs assessments from 4 to 6. So what commissioners opted to do was give the option of anywhere from 2 to 6 for your needs assessments that are identified. So you're not required to submit 6 total. If you wanted to continue 4, that's great. Or if you only had 2 identified needs, that's fine too. We're still going to have to do the data piece that's there. And it has to be an equal number. So if you're submitting 2 needs, 1 has to be mental health, 1 needs to be substance abuse. Just like it was when we had the 4. If you're submitting 6, 3 need to be substance abuse, 3 need to be mental health. I sent out an email also to Richard and Lynn. I think I may have sent it to you too. I can't remember if I sent it to just the chairs or if I included the vice chairs on this too. But Ellen Alejandro, who is our director of research, is looking to put together some resources for all of the regional councils to use as far as gathering data for the needs assessment process. I've found in almost every regional council that's the most difficult piece, is gathering that data. What's relevant data? Where do you find it? All that. So she's really wanting to know what would be the most beneficial data to you all when working on the needs assessment. Could be COVID related too, especially, we've been dealing with this for the past 2 years. So I'm sure there might be some COVID related data you all might be interested in as well. But she really just wants some suggestions and input on what would be the best data that you all would be interested in when compiling this needs assessment. So there it is. There is the big change. It's still going to be due in April, like it is every year, and something that you should all just start thinking about sooner rather than later. As you know, it's quite the undertaking. It's a very important piece for every regional council because it's used in the development of the 3-year plan. The department looks at it. Commissioner Williams looks at it. So you really want to put in as much time as you can, but that's the biggest change. So you can submit either anywhere 2 to 6, whatever you feel is needed in your region. But yeah, and if you have any suggestions as far as data that you would be really interested in, please submit that to Richard or Lynn to share with me, so that I can get that to our Office of Research, because she really wants to put something together that will be useful for you all.
And just to add to what Kirby was saying or has said, this really gives you guys a lot of flexibility. But if you can get that information back to Kirby by her deadline date as identified in the email, this is the best opportunity right now to get those resources that you need, get input on those resources that you need. And for those who may be interested, who do not normally attend our statewide council meeting, the upcoming meeting in December is when Ellen Alejandro will be presenting that information on some resources that can be very helpful to you in this upcoming needs assessment process. So if you'd like to join for that meeting, it's open to the public. You can let Kirby know and she can make sure that you get the information to participate in that meeting. So this is the time, guys, to give us input on what you need, and we're trying to get it for you. We're hoping that a resource page, Ellen and her team also going to put together a resource page, 1 or 2 pager to share with the regions as a part of this needs assessment process. So just wanted to make sure that you all have everything you need. And as much as we can help you with that, that's what we're trying to do even more this time around. So please let us know.
I think I'm back. Can y'all hear me?
Yes.
We can.
Yes, there you go.
We're losing you, Richard.
I think there's some lag time.
And y'all know we just meet once a quarter. Our next meet will be in January. Oh, me. Well, I apologize. I don't know what's going on. Can you hear me now? If you can, I want to go ahead and introduce my friend Leah Gray. Can you hear me?
Yes.
Okay, Leah.
Yes.
Are you ready? Okay,
yes.
Leah Gray is a longtime friend, very involved in the community here. She does CIT training for the police department's first responder. And I asked her today if she could give us just an overview of CIT training. And then I think she's going to announce a conference in November that'll be open that people can attend. So, Leah, I'll turn over to you to say whatever you got to say, girl. And I appreciate you doing it.
Thank you, sir. hopefully my internet will hold out. I'm actually out at advanced CIT training right now at the Sheriff's Department and sitting next to the air conditioner where I'm freezing. So am I pretty consistent? Because my picture is breaking up some. So nod your head or do my yes sign if you can hear me. Fabulous. So my job title, full-time job, is a program manager for NAMI, which is the National Alliance on Mental Illness. And I recognize a lot of you, so I'm glad to see you on this call. In the programmer manager status, I work with crisis intervention training. I also work as the executive board chair for the CIT team here in Madison County. So I had some experience with CIT prior to going to work with NAMI. If you've never heard of CIT before, it's basically a Memphis-based program that teaches law enforcement, first responders, how to talk to those people that may have a mental illness who are in crisis. Now, Madison County is a little unique in that we have branched that out. So we don't just train law enforcement officers. We train anybody that plays in that same sandbox. So we look at law enforcement officers, corrections, probation, parole, EMS, school officials, parks and rec. And the purpose of this is to help us form a community partnership. Some of you may be familiar with the Mental Health Collaborative here in Madison County. That is a part of CIT. CIT is about forming these community partnerships between as many different resources as possible, so that when law enforcement or first responders go on the scene of someone in crisis, not only can they help de-escalate that situation, but instead of taking people to jail like we used to 5-10 years ago, we can actually find the help that they need. And that may be taking them to pathways, taking them to an A&D assessment center, or it may just be calling their friend and saying, hey, so-and-so's having a bad day right now. Could you come and talk to them? And it's really worked out well here in Madison County because we are seeing a lot of our officers being trained and working with these individuals throughout Madison County in group homes and de-escalating the situations a whole lot more than what we used to. We do have a conference, we being NAMI, have a conference coming up. It is our first crisis intervention team conference, and it will be virtual. It's on Eventbrite. I posted the link in the chat box. This is a free virtual conference that does have 6 hours of post credit for it, which is what law enforcement officers need. And then we also have pending CEUs. So those with a licensure status that need to have CEUs to maintain that license, this would be a great conference to attend. There's a couple of things going in with that conference. First of all, one of the things we're focusing on is self-care. What we're seeing is a lot of people in the mental health profession and in the first responder profession burning out fairly quickly. We're all shorthanded, we're all overloaded with work. So we actually have people coming in to talk about some self-care strategies that people can take away from the conference immediately. We have consumers coming in. One of our main speakers is actually he was a homeless veteran that received services, has had multiple interactions with law enforcement, and now works as a peer recovery specialist. So he's going to be talking about his journey. We have Veterans Administration coming in, and they'll be talking about different resources that are available. But our main goal is to give those people that attend, one, immediate things that they can use to better improve communication with those with mental illness, which is a lot of the population. I know for me, I use CIT, what I've learned in CIT with my kids almost every day. We're in here talking about it. We use it on our spouses and everything. So it's a great communication tool. Two, we want to find out ways that we can help ourselves and keep ourselves healthy. And then also we want to find out what resources may be available statewide and how to use those resources. One of the things we've talked about is there's multiple resources out there, but a lot of our officers and our responders, they don't know about the resource, or if they do know about the resource, they don't know how to utilize it. So we're looking at doing that within the conference as well. Again, that's free. The Eventbrite link is up. You get CEUs, post credit. Also, if you are interested and you're here in Madison County in attending a 40-hour CIT training, you're more than welcome to contact me. I'm going to put my email address in the chat box. It is free for those in Madison County, and as a part of NAMI, I am currently working in the West Tennessee area to branch out CIT programs to grow what we're doing across the state, specifically here in West Tennessee. So if you're interested in being involved in that in any form or fashion, whether it's coming in, speaking, sharing your resources, going through the training, which is a great networking opportunity as well, please don't hesitate to reach out to me. We'd love to have you. And the best news of all is we have good free lunch during the training here in Madison County. So lasagna, baked potatoes, all kinds of good things. It's not box lunches, which is always a key selling point for me. So any questions, comments, or smart remarks? It's the way I usually close my classes out. And Julianne, glad to see you on this call. We are ready. If you want to show up early today, you're more than welcome to come on out.
Yeah, I was planning on going straight from here. I actually live around the corner from where I'm going to speak, so I'll be there.
Oh, that's perfect. Bring your coat. It's freezing in the classroom. I'll give you that heads up.
Okay.
So, anybody have any questions or anything that I can answer for you at this time? Whether it's NAMI based, NAMI has a lot of free resources. And like I said, I'm specifically able to answer questions on CIT if you have any of those.
Yeah, I have just a comment.
Okay.
CIT is so important, especially in times of today. You know, so many times you see officer-involved shootings or where somebody dies. And when you look at the case study, there's always, or 95% of the time, there's some mental health background there. And I think it's so important for first responders, police officers, everybody involved to have that training, because I think it can save lives, and it can enhance the community when police officers aren't shooting people or people aren't shooting police officers. So I think it's really important, and we appreciate the work you do.
Thank you. And y'all, I will say the officers that I work with and here in Madison County, and I work in EMS and for county fire, we've got some really good, passionate people here that are really willing to go out and talk to some of these consumers and help them find the resources that they need. So the more we can help these officers understand what's available to them, I think the better off we'll be here in Madison County as a community. So Richard, thank you so much for allowing me to come speak to your group. I really appreciate it.
Thank you, Lynn. We did skip over when I was offline for whatever reason. I don't know what's going on, but there was an adult committee meeting on July 14th, statewide adult committee meeting. Lisa Helton, who is Assistant Commissioner with the Department of Corrections, talked about some of the alternatives they're looking at as far as incarceration, maybe some diversion programs, things like that. And Rebecca Provost Emmons, who most of us on this call know, she's a good old Jackson, McNairy County girl, presented. She's the Criminal Justice Director for Department of Mental Health and Substance Abuse. And she shared the information. There's 82 recovery courts now in the 95 counties of Tennessee. So she talked about the recovery courts and then some of the ways that people can get into substance abuse treatment through community treatment collaboratives, through state probation ordered treatment, or through the ADAT DUI fund. So it's kind of where the adult committee meeting went. Agency announcements. Do we have any announcement? Anybody got some great stuff going on? I know we all do, but announcements?
I'll throw one out there. Scarlet Rope is having a fundraiser on November the 6th at Hub City Brewing, and it's a wing cooking competition. And so it's 3 p.m. until about 8, and then I think Hub City has a band coming on after that. But we're still looking for sponsors, and we're still looking for some grill teams, some people to compete. So if you know of anybody that likes to grill and thinks they can do a mean hot wing, then send them my way. But also, I'd love to see y'all there. It's $25 to get in. Get your dozen wings. We've got cornhole, bowling. It's a family event, football, all the things. So November the 6th, starting at 3 p.m. to about 8-ish at Hub City Brewing in Jackson. So
Thanks, Julianne.
mm-hmm.
Anything else?
Can I make an announcement?
Sure you can, girl.
Hello, Richard, everybody. It's Mary Linden from TADS. We do have a conference, an in-person conference, no less, in November 15th and 16th, about, it's called the New Frontiers in Addiction Conference. It's to address cannabis, kratom, and vaping in particular. And it has a treatment track, a prevention track, and a science track. Although we have some of our presenters will not be there in person, actually most will. And so we have speakers from NIDA, from the FDA, from several other federal partners that I think would be interesting to many of you. So thanks, Richard.
Thank you, Mary Linden. And just because we got a few minutes, you know, I'm reading so much on kratom now. We test for kratom on our campus. We, you know, at least a couple of times a month, somebody's using kratom here. I know there's been a push, and some states have made kratom a controlled substance. Thoughts on, and are you familiar with kratom? Is everybody familiar with kratom? It's kind of an opioid replacement drug that's you can buy over the counter. But it has caused some problems, and I think that would be a great conference to get to learn more about kratom. You know, hopefully I know TADS took it a couple of years ago, 3 or 4 years ago, to look at, to see if we wanted to push to have it as a controlled substance. And ironically, the same day we were on the Hill, a lot of kratom representatives were on the Hill that day too. So it's going to be interesting to see where that goes.
Hey, Richard, I do have just a question. Where are you getting the drug tests that have kratom, that test for kratom? Because I'm having a hard time finding that. If you can just send me that, email me where you're getting those from.
We will. We had a hard time finding them too, Julianne, and I think we ordered a couple of hundred when we finally found some. But we'll get that information.
Is it a different dipstick or is it on the whole panel?
No, it's a different cup and everything.
And it's just got the whole panel plus kratom. It's not just a kratom. Do you know?
No, the ones that we're currently using are just kratom.
Okay. Well, if you can send me that link, yeah, that'd be.
Yeah, we'll get it to you.
Well, we did have a presentation at TADS from a company, and Richard may help me remember their name, began with an A, but they had a full panel that included kratom. Do you remember who that was, Richard?
I don't. I remember him being there, but you're right. It started with an A, but I don't remember.
If you want to email me, Julianne, I'll try to dig it up for you.
Okay. Anything else going on? Well, again, I'll be so glad when we can all get together because, I mean, we can learn what we need to do here like we're doing it right now, but it's just not the same as being able to look at each other across the room and shake hands and get a hug and swap ideas and just the network opportunity that this presents. But if there's nothing else, the chair will entertain a motion to adjourn. Or not.
I make a motion that we adjourn. This is Megan.
Okay, Megan.
I'll second.
Motion's been made and properly second. Any opposed? All ready to adjourn? Smile real big. All right, we're adjourned. Thank you.
Bye, everybody.
Thank you.